All right, everybody, welcome back to another episode of the Founders Cut. Today I'm here with the CEO and founder of Mother of Fact, Emily Sylvester. Emily, thanks so much for joining me. We're looking forward to having you tell your story. Before we jump into what Mother of Fact is, we'd love to just kind of hear about your journey to becoming entrepreneur and CEO. Where were you before you decided to take this on?
Yeah, thank you so much, Adam. It's great to be here with you today. Yeah, I am a mom of three under the age of 8, and my career led me on a path to become a registered dietitian and board certified lactation consultant, and loved my work in communities and large hospital systems in the New England area. And did that for 15 years. And just realized the work we were doing. So, Adam, I was primarily working with babies and children's diagnosed with something called failure to thrive. I was working with prenatal patients on breastfeeding and working through infant feeding issues such as food allergy, formula intolerance, breastfeeding. And I came to the realization that doing my work, which we were philanthropic funded, so I was able to do home visits, see them in clinic, and go to schools, which is not a scalable model, right? That takes a ton of time, a ton of attention, but our outcomes were amazing. And so I said, how do I keep scaling this? Because the answers from my bosses and the hospital systems who are aware of budgets kept saying no, kept saying no, we have to figure out how to fund this. And I said, well, I think I can scale what we're doing. And jumped into the world of entrepreneurship, not really understanding what that really meant, which I think was a good thing for me. You don't know what you know until you know it. And I feel like for some founders, that's how they get their leg up. Like, we're not scared to take it on because we don't really understand what we're getting into yet. And did my first pitch contest. I was 9 months pregnant and did that, got accepted into the accelerator program, gave birth 5 days later, and did this business accelerator program at the time. It's called E for All, which was amazing during my maternity leave, like any normal person does, right?
I love that story. Well, sounds like you're pretty much a superhuman to be able to, get through the early stages of, raising a baby, but also doing a full-time startup founder launch, right? I don't know if I could do that if both of those things were put in front of me. So let's jump into a little bit more about what Mother Effect is. If you had to just describe it to an eighth grader, how would you describe it?
Yes. So, Mother of Fact is for women's health clinics, and we're a digital health platform that connects patients with registered dietitians for appropriate nutrition care. Now, the focus of Mother of Fact right now is in fertility care, prenatal care, and postpartum care, is where we're really focusing our efforts, saying that the maternal death rate right now in the US is pretty much the highest around the world. If I were to give birth today, I'm twice as likely to die during childbirth than my own mother was back in the 1950s. And we know through research that 80% of these deaths are preventable. And as a dietitian and a lactation consultant, and through copious research, we know that nutrition and preventative care around diet and health and wellness can save moms and babies.
So, I hate to be a numbers geek, but you talked about 80% of these deaths are preventable. How much of a needle can be moved just from the diet perspective?
That's a really good question. When we look at the etiology of the deaths that are occurring right now, there's a lot involved, right? I'm not looking to solve the entire problem. I'm saying that a lot of the diagnosis in these high risk pregnancy conditions, if we bring in nutrition into the equation for things like high blood pressure or preeclampsia, gestational diabetes, obesity and pregnancy, and general healthy eating, that goes into birth complications that are occurring at an extremely high rate, which lead to C-section, premature birth, and women bleeding out after birth, which is a huge contribution to the death rate right now. I'm not sitting here and saying, you eat an apple a day and that's going to save your life. No, but I'm saying looking at the patterns and looking at what we're seeing with how women's health comes into the picture, mother of fact can make a significant impact related to those conditions.
Okay. Um, so for an expecting mother that wants to explore your services, how do they get their hands on your app, right? Do they need to consult their physician, or can they do this on their own if they want to jump on the App Store and just download it and go?
Yeah, I love this question. Thank you for asking it. So, in the current customer journey, if we call healthcare system, a company, right? As a customer in healthcare, and you're a pregnant person or somebody that wants to become pregnant, right now you need to take out that seeking of nutrition care, health and wellness, breastfeeding education yourself, which means that you need to know the questions to ask, you need to know where to find it, and you need to be able to afford the services. When I launched the prototype of Mother of Fact, a couple of years ago, I had a grant from the Academy of Nutrition and Dietetics to basically say, how does unlimited access to a dietitian via text messaging and video education impact maternal efficacy? And our numbers were significant. From there, I said, well, looking at the barriers to access to nutrition right now, you have to have the money, you have to have the time, you have to have the knowledge. Unless we integrate this into current healthcare systems and customer journeys, we're not going to move the needle for impact on outcomes. And so the way we built Mother of Fact the last couple of years, doing intense customer discovery and fertility and OBGYN and midwife practices, is we are a B to B to C company right now, Adam. So I say I have this digital health platform. We built it out with the end user in mind, meaning under-resourced, low-income Medicaid families, or those families that don't have a ton of time to go out and look for help, or they're looking for help after problems come up. And I say we do an excellent job of providing culturally appropriate, accessible nutrition care on our platform. Hey, clinical center, hey, Bay State Health, we know that 20% of your births at minimum are high risk. We know that you do have a registered dietitian, but they're one FTE covering 5 FTE positions. You contract with Mother of Fact so that every time a diagnosis code comes up where nutrition care is appropriate and necessary to treat conditions or prevent conditions, you refer your patients to us. And we offer 5-star treatment related to what we call medical nutrition therapy. So that is the care that dietitians provide through current recognized insurance reimbursement codes. So we are insurance reimbursable service that can be integrated into current clinical care, removing the cost from these users. So families and moms and birthing people can find us on the Android and iOS App Store. They cannot access us unless they have a code from their physician right now, because I'm trying to tackle it from the inside out, which is what differentiates us from some of the other services out
Yeah.
there.
Yeah, it makes a lot of sense. When I was doing my healthcare startup, we also took the approach of going B2B to get to C. Primarily for a lot of the same reasons, right? We felt that the main benefactors of our platform were probably coming from underserved populations of patients and customers, and so we knew that we didn't want to pass that burden on to the patients. So it makes a lot of sense. But I know from your perspective, it's also a lot more sleepless nights trying to chase after these long sales cycles and whatnot that some of these hospital systems might have. So, on in that similar vein, if you were to come to a hospital administrator and say, "Hey, look, here's the best ROI you can put to work for you," like what are you telling these people when you have a chance to speak to them? Like, how are you convincing them? Because at the end of the day, as pessimistic as this sounds, hospitals and healthcare and providing care, it's a business, right? If they can't make money or save money, they're not interested. As terrible as that sounds, right? But I've been doing this long enough to know that, like, having the best solution isn't always the right answer. It's also like, what can you do for my bottom line? So what's like your heavy hitter swing that you come in there with?
Yeah, I love this question as well because looking at what I'm doing as a female founder, pitching a femtech company in maternal and infant health, yes, everybody wants to save lives, absolutely. And our market size is big enough. I mean, everybody comes from a vagina, right? But you're right, looking at how we're selling this and integrating into an enterprise sales for healthcare. I know that's not easy. I worked from inside the healthcare system. And so we've done intense work to de-risk this and kind of state the ROI right from the beginning. And so we go to a clinical center and we have different levels of contracts, whether they're a small entity who sees, 40 birthing patients a month to the larger hospital systems. And I say, hey, look, if you contract with Mother of Fact, not only do we not take up clinic room or staff time, but for every 100 patients, there's $40,000 return in potential time savings. Because what happens is nutrition information, our reimbursement rates are on the low end of the total poll. To be completely honest, nutrition and preventative care is not held highly in the healthcare system. So I say, your staff doesn't have to do that. You can save that room and that staff time for higher reimbursable codes or services. We see a 25% increase in maternal efficacy during their customer journey. What that means is more customers want to come to their clinics. They want to stay with their clinics for their next baby, and they're going to tell their other moms because mom word of mouth is gold to go to that clinic. And then we know that there's at least a $15 increase in revenue for every dollar invested in dietitian-led lifestyle modifications. So I say, you pay us a contract fee for our services, and you're going to make up to 200% return in the insurance reimbursement that you're going to get from our services. It is how I'm selling it. That is the tip of the iceberg. Then I go and say, these populations are really hard to access. They don't have cards to get to their appointments. The no-show rate for OBGYN appointments is really high. And I say, I'm talking to these patients every single day. What data is most important to you? We'll get that back to you in order for you to not only improve your care, but go for additional funding, non-dilutive funding, because DEI initiatives and maternal care initiatives are hot right now in healthcare attention and government guidelines.
Yeah, no, that all makes a lot of sense. And, obviously the hardest part in a lot of ways is getting in the room. The second hardest part is keeping momentum up, right? And then the third is actually closing the sale. I mean, it's all part of the whole sales cycle in general, but, I think you're in one of those industries where the dam is very high, but when the dam bursts, it goes very quickly. And so, it's cool to see, in terms of just like your early success, like talk about some of the wins that you've experienced, since you've started this company. It
Yeah.
could just be as small as just like one patient case, or it could be as big as like we locked in this really cool customer, or anything that you think is just cool for the audience to hear.
Yeah. It's interesting you're using a dam analogy because we've had so much flooding here in New England recently. Like the dams are overflowing. And I think for Mother of Fact, we are just at the tip of that dam overflowing. We just learned we got a $150,000 NIH award grant to perform our services in coordination with a healthcare system in California, in LA. So we launched that last week and we'll be running that the next
Can
year.
I
Uh,
interrupt you real quick?
mhm.
What is the outcomes that you're looking to um, achieve with that grant? Because every grant has like a specific goal. Like, what are you trying to figure out with that?
Yeah, so we are partnering with Clarice Health that sees Medi-Cal patients from ultrasound through pregnancy. And we're specifically looking at gestational diabetes prevention and treatment care. So we're going in and saying if these families have access to a digital health platform and their own dietitian and and understandable information that we're going to decrease the incidence of gestational diabetes and the incidence of use of medication treatment. So that's specifically for gestational diabetes, which is really exciting because up to 10% plus of pregnancies in the US
Yeah.
can have gestational diabetes occurrences.
Well,
Um,
congratulations on that, because getting those grants is not a simple fact, simple act. So kudos to you and your team for for locking that down. Yeah, sorry, I interrupted you halfway through kind of talking about some of your wins, but I was curious. I always get curious when someone says they got an NIH grant. So,
Yeah, yeah. Other wins is I'm currently a Future of Healthcare founder at the Rue Institute at Northeastern University. That's out of Portland, Maine. And they launched this program specifically for the rural populations of Maine and recognized, the top 9 companies specific to the needs of Maine. And looking at the Maine ecosystem, we can pretty much replicate that for other areas in the South, the rural areas in the South, where maternal death rates and breastfeeding rates are extremely low. And so we're working in partnership and got investment from 2 of the largest hospital systems in Maine to run our solutions through them. And they really saw potential in what we could do for their rural birthing populations. Maine has the largest maternal care desert in New England.
I'm assuming a maternal care desert is similar to like a definition of a food desert. It means proximity to the types of people they need access to for the care that they need for their maternal health.
Exactly. Yep.
Okay.
Yeah.
Yeah. I would have never guessed that Maine would be so high up there in that regard. If you would have asked me, I would probably would have said, um, I don't know, a bunch of other places before then. Oh, sorry about that. Give me one sec.
Yeah.
I got a golden doodle that likes to bark at anybody and everybody that walks in the apartment hallway. So, um, okay, so two-part question for you. First part being, if people want to come in contact with you to learn more, how can they reach you? And then fast follow, what types of people would you like to get connected with that might be listening to this episode?
Yeah, I am mostly on Instagram. My lead dietitian, her name is Chacha. She is phenomenal. So her and I tackle user information and confidence. So baby feeding, pregnancy, fertility, nutrition information on Instagram, and we are at Mother of Fact app. I am regularly on LinkedIn, Emily Sylvester. And then we also have Mother of Fact account. But following our journey, I like to post on LinkedIn, um, posting our milestones and our challenges and, raising up others in the healthcare system and beyond who are also going through these challenging times with really amazing ideas. So I would love to see everybody pop up on LinkedIn as well. And we're at motheroffact.com for our website to check out our services. And then next month or so, we are launching a new B2B VIP page. So when this comes out, maybe that will be launched.
All right. And then, well, if someone might be listening to this episode, I like to help people connect the dots of, I think humans are great at amassing really cool people in their networks. They're not so great at sometimes being a matchmaker. So, like, yeah, for someone that might be listening that might not work directly in a healthcare system, but maybe they know somebody, maybe they're a neighbor, maybe they're a family member. What types of, I guess titles of people are you generally trying to interface with to help get the conversation started?
Oh, yes. Oh, yes. So I'm looking to connect with anybody who works in women's health with women's health clinics. So our ideal customer journey, right, is bringing on a user when they're thinking about getting pregnant, trying to get pregnant, or are pregnant. And so any of those clinics that are providing fertility care, pregnancy care, hopping on these conversations is amazing just on the discovery call capacity. We have quite a bit of organic inbound, but we are starting to launch our direct sales processes and looking at those organizations who are in, rural areas, serving, under-resourced populations and recognize the value of nutrition care. Now, when we did our, 100 conversations with OBGYNs, 9 out of 10 of them came back and said, we know nutrition can save lives, but we don't have accessible resources. And so just having those conversations around that is really exciting. So midwives, nurses, admin staff, nurse practitioners, family medicine doctors, or community organizations who are working with a similar population. I mean, we're coming together and building a consortium, right? Saying that we can't all be in these silos, whether we're doing doula care, nutrition care, fertility care, or comprehensive pregnancy care. It really takes a village to move the needle in what is going on in the USA today around maternal and infant health.
Yeah, no, and that makes a lot of sense. It's a complex issue, and so it takes a lot of different people to make it work. Um, let's talk about, you know, a future roadmap. It sounds like you've got a new feature coming up for the website for VIPs. Any other big milestones on the horizon, or maybe even if you don't want to talk about that per se, maybe just some people you want to shout out on your journey so far.
Yeah, so coming up on the horizon, we're looking to close more clinics and launch in 5 states. So we are looking to target, this goes into your who to contact to, I think, question in Alabama, Georgia, California, Maine. And we're talking to an organization actually out in Oregon, which is really exciting. And why I shout out specific states in expanding is when it comes to nutrition care, it's really important for us to kind of fan out as we're going into certain states, because when it comes to dietitian care, we're hiring dietitians who are familiar with those areas, because that comes into providing really good, comprehensive, culturally appropriate care. And so once we're established in a state, we want to create additional partnerships in that state to spread out what we're doing, not only revenue and opportunity wise, but community enhancement wise. And so we're looking to expand to 5 states, launching to 500 patients by the end of the year. And we are launching additional software development capabilities when it comes to integration with clinical centers. We have our app, we have our backends built out. We've done that around usability, specifically because we all know health and wellness apps that like employers offer, right? Which sound really great, but the utilization is like 6%, right? And so Mother of Fact really focused on that utilization first, developed our ideal customer profile, and now we're attacking that, recognizing that our app is really usable from the ideal users we want to get on it. And then we have an open funding round right now that we're working on closing out in the next couple of months, which is really exciting, to really move us forward as far as business security, working with hospital systems and enterprise sales. That takes some capital and knowledge, and we've been really smart about that so far, but expanding that as we expand to additional networks is really important, and grow our team, and create a really solid foundation for our team members. When Adam, when we talked like a year ago, it was still me, it was still my CTO. We were really bootstrapping, and
Yeah.
being really aware about how we were building our team. But now we have, $6 million in contract potential out there. It's time to really focus on building that
Yeah.
team.
Absolutely. No, that makes a lot of sense, and yeah, congratulations on the growth of the team and the growth of the contracts and the user base and the customer stories. You've come a long way in a short amount of time, so kudos to you. As we wrap this up, I always like to give the founders a chance to kind of give some advice to the next wave of founders coming. Anything that you want to share with people that might be listening that might want to start their own company?
Yeah, yeah. I think that comes with the shout out. I think it comes with, spend a lot of time in networking right away. It seems like it doesn't get you very far, and it can feel like spinning the wheel, but network is everything. And so spend a considerable amount of time in that at first, in addition to building out your systems and testing with the users. I think those are the top three, right away. Which sometimes that's really hard to do as founders. We're really excited about our product. We want to get it built. We want to get it out in the world, and we do all of that work and spend money before developing our network, getting feedback, and getting it out to our users. I think I was fortunate early on to meet, my early advisory board members who worked in government contracting and really gave me some guidance around building this and getting it out. And then finding mentors and advisors not only in your industry. So I just finished Techstars Boulder back in April. And people are like, well, why are you doing Boulder? Like that, they're not healthcare. And I said, I'm doing Boulder one because the managing director team was phenomenal. And because of their marketplace focus, I could really work on my enterprise sales strategy, knowing it's not specifically healthcare, and then take that and bring that back to healthcare potential, stakeholders and really have the right questions to build. So making sure when we're finding a network, it's not only, I'm in nutrition, I have to find those nutrition people, or I have to find an OBGYN. It's looking for well-rounded advice, because when you're trying to change and evolve an industry, sometimes you have to think outside the box.
No, I think that's all great advice. And you gave actionable examples. And yeah, building network is probably one of the most exhausting things that seem like they don't pay off immediately. You don't really realize the potential or the power of it until probably sometimes months or even years down the road, when someone you met before and stayed in contact with ends up becoming someone that's very helpful for you. And and hopefully you can be also that same person for somebody else. I can't agree more. Network is so key to oftentimes so many people's success. And you might be wondering, why does that person succeed when I don't, but they have the same skills as me and the same background, and we think the same way. It might just be they know a few more people that help them, move the needle in a certain way. So I think that's a great piece of advice that people should really chew on if they look in the mirror and say, I don't really have a strong network. It's just a couple coffee meetings a month, and it's a great place to start, right? So, well, Emily, thank you so much for joining on the Founders Cut. If people want to find you, they can just look for Mother Effect on Google, I'm assuming, and you'll be probably one of the first ones to pop up. Find them on Instagram, find them on LinkedIn. And if you know somebody that's in the healthcare network, healthcare world, in the women's health world, give Emily a thought and see if you might know someone that might be interested in learning more about how they can help patients, be healthier, but also help the bottom line of the institution that they're working at. So, Emily, once again, thank you so much.
Appreciate it. Thank you.